I love the emergency department. It's chaos. I want to go home at the end of the day and know that I did my best and was able to take care of patients. And that's becoming harder and harder to do. They're just stretching us so thin that we can't take care of people appropriately. It's pretty common for me to have patients waiting there for 6, 7, 8 hours.
After a delayed vote because of the government shutdown, hundreds of nurses at 4 UnityPoint hospitals in the Des Moines area are voting this weekend on whether to unionize with Teamsters Local 90, an election being closely watched by non-union nurses across Iowa who are also struggling with understaffing and patient violence. The postponed UnityPoint vote among 1,776 healthcare professionals at Blank Children's Hospital, Iowa Lutheran Hospital, Iowa Methodist Medical Center, and Methodist West Hospital has been rescheduled for Sunday, December 7th through Tuesday, December 9th. It's the state's largest private sector union election ever. For Iowa Starting Line's new series, Clocked In, Iowa at Work, I spoke to some of those workers to better understand what this fight's about.
When they approached senior leadership, they were basically told nothing's going to change, and so you just need to suck it up. We had a couple nurses that were really riled up, and they were planning on staging their own walkout, and so we all just kind of started talking, and we're like, no, this is actually what we need to do.
I had already tried talking to leadership. I'd worked with UnityPoint long enough to see that there weren't things changing, that they were just adding on more and not actually fixing the things that we had issues with. The emergency rooms were overcrowded and full of patients all the time. It's been disappointing to see a company that I thought did a pretty good job in the beginning. Their slogan is "You Matter," but what they are doing currently is the exact opposite of that. They're retaliating against people that are union supporters. We get security called on us every single time that we table. It's an intimidation thing. They're holding illegal captive audience meetings. They're paying thousands and thousands of dollars to these people to lie and to persuade nurses to vote no because the union's going to take away their ability to have a say in anything, which is absolutely not true.
Because we don't have a say in anything as it is. But
yeah. Throughout this organizing, I've seen how unfairly the company's treated some nurses. And what they do is they bully and intimidate people into quitting. Like, somebody was assaulted. They actually broke their back from the assault, and the hospital was giving them occurrences for not being able to come to work because they were in too much pain. That type of stuff is the stuff that's super disappointing because I thought better of this company. It's estimated around $6 million that they've put in to try to stop our campaign. What could we have done with $6 million for the nursing staff, for patients that come in and tell me that I haven't eaten in 3 days and they're homeless and have nowhere to go? What could you have done with $6 million instead of paying union busters? It's a blank check to try to stop us, and all we want to do is be able to better advocate for our patients.
UnityPoint put out this statement, noting that they would prefer direct collaboration between managers and workers, and thought a union was, quote, not in the best interests of our patients, our nurses, or our community. But nurses disagree.
We want the best care for them that we can possibly provide. And that means that we have to be able to take care of ourselves. Safe staffing actually saves money for the hospital and gives money back to the hospital in terms of better patient outcomes. The length of stay gets decreased because patients are able to get better faster. And it's better for nurses. It decreases burnout. It makes us want to stay in our job. It means people don't leave the bedside. So all of these things create such a net positive for the community.
Do you work in healthcare, and have you experienced this? Comment below and make sure to subscribe to our newsletter and follow Iowa Starting Line for more news for workers.